All right, we're live. Welcome, everyone. This is our inaugural Ask an Expert series and I'm very honored to be the first expert for Kintec here. My name is Dr. Michael Ryan. I've been a pedorthist for a better part of 15 years, working clinically. I also have a PhD in experimental medicine and biomechanics, and have some experience working in physiotherapy and sports medicine clinics in Vancouver, in Wisconsin, in the US, in Germany, in Tübingen for a brief period from first year of my graduate work, and then most recently for a 4-year postdoc at Griffith University in Australia on the Gold Coast. Lovely place. Right, so anyone, you can send me your questions, and they'll pop up on my display here, and I'm happy to answer them. We do have some email. Some of you have emailed some questions in first, so I'll get to those. And okay, and then and so we'll go answer everyone's questions as much as we can, and then go into detail. If anyone of you who have asked a question are live, I'll let you know. So I have a first question here from PJ. Thanks for your question. Asking after their 9-year-old son, who is very active in sports and has been recently struggling with heel pain. And so, what are the best options as far as treating this? So this is a common problem a lot of times in athletic kids populations, especially as kids are getting into more competitive sports, and especially as they're getting into adolescence. A lot of times the pain is on the back of the heel, what we call the posterior side of the heel, where the Achilles tendon attaches at the back of the heel. And it's commonly called Sever's disease, if it's what I'm thinking is. I'm going off the notes here, so bear with me. And PJ, if you are on the air, feel free to give me more detail on where exactly that heel pain is. But assuming it's at the posterior aspect of the heel, then it's likely a condition called Sever's, where the growth plate hasn't completely fused yet, which is common. I mean, everybody has these growth plates. It's how our bones grow in length, but when there's a lot of traction forces placed on the very end of the growth plate, such as in a developing athlete who is anywhere between 9 and 13, a lot of times these forces get higher than the bone, and the area where the bone attaches can accommodate, and it causes some irritation there. Really, the best way of managing this pain is activity modification, although in many cases this isn't an option so much anymore, especially with trying to accommodate developmental tracks for especially young soccer players and other kids in that area. So we try to manage that pain as best we can. Orthotics can help, especially if the foot posture, so if your son or daughter has a particularly flat foot, they may appreciate having a bit of control with an orthotic. They may also appreciate a low-dye tape job. Sometimes the compression with the tape helps that area and takes a bit of stress directly off where that Achilles attaches, as well as possibly any sort of compression garment maybe. And then of course any sort of deep massage or stretching on the calf muscles to make sure they're not excessively tight, which often is a factor in these conditions. Given that the bones are growing quite quickly and then the soft tissue is having to catch up. Right, so again, if those of you are joining us, it's Michael Ryan here from Kintec. I'm a pedorthist, and I'm answering your questions on foot health or shoes, today, feel free to post them as they come along. Welcome to try to address them real time. I've got a question from Jackie. Thank you, Jackie, for sending your question in. You have, apparently, she writes, I have a few stress fractures in my foot. And I understand the need for rest, she writes, but I have 2 dogs that need walking daily. I have an air cast that I find when I wear it, my hip on the other side gets very sore. Any suggestions, please, and what can happen if it gets worse? I'm just going to check the bottom here. Okay, good. Jackie, yes. Thanks for your question. And stress fractures are their challenge, certainly in terms of treating, and they're one that really demands rest. It's hard, if not impossible, to try to get around not resting because this is simply a function of making sure that the stress is below a certain threshold for the bone in order to heal. And if you're above that threshold, whether the dogs need to be walked or not, unfortunately the stress fracture will not heal. And this can, at the very least, just lead to an unhealed stress fracture. And probably in the short term, what might happen is continued compensatory pain on the other side, like you're noticing with your hip. And certainly we wouldn't want a back injury or further pain at the hip that could become more severe than the original stress fracture. So it's good to pay attention to that. If you haven't seen a sports medicine physician to help give you some guidance in that respect, I recommend that you do so. It's worth confirming that this is indeed a stress fracture through either a DEXA or a bone scan. That are very sensitive to that, which I imagine you do if you're already aware that they're a stress fracture, as they don't often show up on plain film x-rays. And as far as the dog walking, I think it's just a case of learning to listen to your symptoms is a big guide for you in terms of knowing whether you are doing too much or you are staying within that happy zone of staying ahead of the curve as far as reducing the stress on that bone or bones if there's multiple stress fractures. Especially in that case, I'd suggest that maybe you only walk the dog half as far as you normally would, or you have somebody else likely help you in doing some of these things, because it is important that you not overdo it. A walking boot is the preferred way of taking load off of the foot with a stress fracture. Using air casts is a good brand for doing that. I believe there are other brands, DJ Ortho and Osser, also make good walking boots for this purpose. With respect to the hip, I'd also advise that you may see a physio with respect to how to make sure that side doesn't get any worse. So whether there's a need for any soft tissue work or manual therapy done on that hip, they can be a big help as far as understanding where the pain is coming from and how you can manage it yourself as you go through the day. Thank you for that. Moving down the list here in our Ask an Expert series at Kintec, we have a question here from Wes regarding another stress fracture question. He's asking, what's the best rehab and time off from running post 5th metatarsal fracture? Isolated, minimally displaced at the base of the metatarsal. And yes, this is a I wouldn't say common running injury, but it is a noteworthy running injury. It does certainly happen, and stress fractures are frequently in the metatarsal bones as well as a little more commonly in the tibia, and can be really frustrating as far as managing, especially if you are a distance runner and you're wanting a lot of running injuries, you can run through conditions to some extent and sort of manage that pain as you continue to at least hold on to a certain amount of running volume. Unfortunately, that does not apply to stress fractures, where there really is a demand to take time off of the sport. Unfortunately, the impacts associated with running are such that it's very difficult, if not impossible, for this bone to recover long enough and well enough while you are still running, and so oftentimes they will get worse if you don't take that time off. Typically it's 4 to 6 weeks off of running entirely. I'd advise, if you are preparing for an event in terms of running and you don't want to take that time off, you're concerned about your conditioning, to look into your local pool or fitness center that has a deep water section. You can just get an inflatable belt that you can wear, and you can do some deep water running. So just follow the same motion you would as you would be on land, and run from basically either side of the pool while you're doing that. I know a master's student from my PhD supervisor, Jack Taunton. They did a study looking at the conditioning effects of overground versus deep water running, and found that they were similar in terms of you did not lose any aerobic conditioning when you were doing deep water running. And yes, as you'd imagine, being in a pool, it's no impact, so you can have your cake and eat it too as far as recovering from the stress fracture and still maintain your physiology and your conditioning, which is so critical. Using, of course, if you have access to an Alter G treadmill, there are not many in the Lower Mainland. I'm based in Vancouver here, but you can certainly source out, and then they can be a good way to help return to running as well. I might then suggest that as you segue back into running, that you might alternate your overground walk running your program with some deep water, so you don't completely transition all the way into the overground. So you don't want to take a step backwards with respect to that recovery. So anyway, so good luck with that, Wes, as far as recovering from that fifth Met. Watch your shoes as well. They should be supportive and with adequate cushioning, and should also fit right without enough compression on that lateral column. So I'm going to just break from my list for a second, because we do have a question from Ellie Greenwood. Thank you, Ellie, for writing in. And she writes, I am a runner with a moderate bunion on one of my feet, and this can flare up with running, and I've noticed particularly so with more flexible running shoes. At the moment, I've been advised that fortunately it is not bad enough to require surgery. She tries a toe spacer and is trying shoes that are a little more rigid. Any advice, or do I think orthotics could help prevent the bunion from getting worse? Good question. I mean, bunions are something that we see quite commonly in the pedorthic clinic, and there's not a lot of clear science that tells us why people get bunions and how, if at all, we can prevent them from happening. My understanding and speculation, because I don't have a ton of, well, there really isn't a ton of solid data as far as or evidence on why people get them, but it's often a combination of having a fairly mobile foot posture, foot joints, as well as having a genetic predisposition in the ligaments in your foot to distending. And so responding to that extra mobility that causes them to stretch, and in particular people that tend to have a flat foot as they are toeing off when they're walking and running tends to be particularly susceptible, I think, to bunions. People can get bunions when they are as young as adolescents, and in their 20s they can become bad, and they can also be acquired later as an adult in the 40s and 50s. for a variety of different reasons. I'm just going to read back here, make sure I do answer your question, Ellie. With respect to shoes and how do we make sure that this doesn't get any worse. The concern with bunions, and when bunions become symptomatic or when they become painful, is when there may be, because of the mobility in the foot and the position of that, what we call first ray, that I've got a model here to show us. So the concern with a bunion is it's with this joint right here, and it's actually the first metatarsal that's the culprit. So what will happen is, if you look at this little joint segment here and consider this like a transmetatarsal ligament, as someone walks, the distance between this ligament gets larger. So imagine the big toe starts to, or the first metatarsal begin to flare more to the medial side, and as a compensation, the big toe then starts to turn towards the second toe, and it's this deviation. Okay, sorry everyone. Looks like we had a momentary technical glitch where it paused the video, and I was explaining bunions and their cause. And so I was using my Frank the Foot model here to help explain that deviation of the first metatarsal head. So, well, bunions are hallux valgus, as we would call it, is just technically the arrangement or the alignment of that joint. When bunions become sore, and usually that bunion soreness would be at this joint here. This becomes aggravating as we start to extend the big toe on the foot. Now, of course, we don't usually, when we're walking, extend our big toe apart from during swing phase to help clear the foot during the ground. A lot of times what will happen is the foot's going to be moving on the toes. And so as you are doing this and you get to the end point, if there is any, the alignment of this joint is in any way impacted, then that can cause some structural changes to the joint itself. This may be early stages of osteoarthritis that may cause that irritation, or it may be just as a result of the actual areas around the joint becoming thicker and causing some joint stress and joint compression that can become quite irritating. So it may or may not be signs of early osteoarthritis. It's something that you would need to see a healthcare professional to look into deeper, and likely they may want to look at some x-rays. But that's often where the source of pain may be coming from a bunion, which certainly warrants having an expert take a look at that. The way that we commonly manage that, and you can have, as we would call this joint here, the first metatarsal phalangeal joint, or MTP joint. If there is pain in that location, with or without a bunion, a lot of times the approach that we would take is to splint that area. So we want to limit how much motion there happens in this joint, and a great way of doing that is through certain shoes. And Ellie, you speak in your post to wearing flexible shoes irritating that joint a little more, which makes sense because the more flexible the shoe would be in the forefoot, the more the foot is going to be allowed to bend on the toes. So using a shoe like our good friends Hoka here, where they have really defined the industry by making very comfortable soft shoes, but that are very firm, rigid sole, so it's very difficult for me to try to push the two ends of this sole together, as well as it has a very high, what we call toe spring. So the shoe and the sole is ramped upwards near the toes. So this allows the foot to just simply roll forward without needing to bend that joint at all. So I would look for shoes that have that. If you don't like the fit and feel of Hoka, don't stress. A lot of shoes have a good forefoot rocker. That's a good term that you'll want to go into a running shoe store and ask about. Certainly at Kintec, our fit experts will know what you're talking about when we say want a good forefoot rocker. But anywhere you go, that's a good characteristic of a shoe to look for. And you know, as we go through this, Ellie, if you do have any questions, or you don't think I've answered your question, feel free to pipe up, and I'm happy to elaborate on any aspects. Right, so there are additions that we can make with an orthotic for that as well. I'd be remiss if I wasn't talking about orthotic therapy for first MTP or for bunion pain. As I said, the concern is trying to protect this joint. There is one of the ways that also that we do this, especially if you do have a flatter foot posture, is through some degree of an arch support. So here I'm holding a custom foot orthotic that is custom contoured to someone's foot, so this is able to provide optimal comfort while being close, offering close contact contouring of the foot. So to avoid pressure being distributed too much on this big toe, which is commonplace for people who are have a foot posture on the flatter side. The more overall weight and force goes through this foot, then the greater the stress, and then the greater the stress to the joint, and often the worse the pain. So having some degree of arch support or corrective arch support, feel free to chat with a podorthist regarding how that's feeling, and they can sort that out for you and help to balance those forces. Okay. Anyway, feel free to anyone else send your questions in while we're going through here, and then let me know if we're getting to the bottom of them. It is an Ask an Expert segment here with Kintec, and you're with Dr. Michael Ryan, Ask the Podorthist. I have a question here as far as trail running shoes. And from Wes writes, he wanted to know what's the best trail shoe and type of shoe for a return to trail running. The current road shoe is Brooks Ghost, and looking for something in a slightly wider size. So, good question, and certainly in our part of the world, in Vancouver and in North Vancouver, where I live, practically every runner I speak to is also a trail runner at certain times in the year. So this is a great way to complement your road running and build strength and distribute stresses of running across different parts of your body, with the challenge of running in a trail where there's a lot of different movements involved, and it really does help to build your fitness and your tolerance. As far as shoes are concerned, it's really a case of trying on a variety of different shoes. I'm a big fan of having perspective when you are shoe shopping. It's hard to know whether the shoe you have is the best shoe unless you have other shoes to compare that to. Naturally, fit trumps everything else, so you're going to be wanting to look for something in a slightly wider fit. So I'm suspecting likely Solomon lines of shoes and the Nike line may not fit your foot quite as well. But it also depends on the type of trail running that you're doing. So there are different trails, as you imagine, especially on the North Shore of Vancouver. You can deal with some fairly technical trails needing a lot of traction and a lot of stability, versus moderate level trail shoes, which are essentially like a standard running shoe, but with added features for protection on the sole plate and durability, because they often are greater forces and greater lateral forces acting on the foot, as well as waterproofing, which is important because you're often going to be more wet. And then there are low-profile trail shoes like Nike's Terra Kiger shoe, which is a great shoe for shorter distances and for helping to build some strength through the foot muscles, but would not be something appropriate for certainly ultra training and for doing longer runs in the trail or something really technical. Wes, I think I'd suggest that you maybe try the Ultra line of shoes. They make two trail shoes. The Lone Peak is their moderate distance shoe. And Ultra are known for having they probably have the most unique fitting forefoot of all the footwear companies that I've ran in, and I find it really accommodating. It is wider, and it is nicely curved, so they do say that it's an anatomically designed fit, so it will be, you don't get a feeling of compression, but the shoe fits stable enough through the laces and through the heel that you don't feel that the shoe is splashy either, so you feel secure in the shoe while giving your toes a lot of space, which is, I think, particularly helpful when you're doing descents at speed when you're on a trail where there's just a ton of force going through the foot and braking force especially on those descents. I do have a trail shoe here, the Cascadia from Brooks. So you might consider a Brooks shoe because you're already in a Brooks shoe if you don't like the Ultras. You'll find the Ultra fit and feel very different from the Cascadia. Again, this is where the perspective, I think, really makes such a difference. From something that has a zero drop, that means the heel is not any higher than the forefoot in the Ultra shoe. You move to a Cascadia here, which is about 6 to 8 millimeters higher in the heel. Also, the softness through the sole here is going to change the responsiveness of the shoe, and that's something that's often an area of very much personal preference. Whether you like a soft feel for cushion, or you like a firmer feel for our energy transfer and responsiveness of the feel, which might segue into greater agility, you might think, while you're on the trail. A couple of things that you'd want to look for in a trail shoe, though, are the lug pattern. As I mentioned, as you get into more technical trails or ones that are having you run through a lot of mud or sphagnum and things like that, especially up in the Whistler area, then you might need a deeper fitting lug so that you can get that traction. Also, the protection against rocks, medium size and smaller rocks against your foot. It is important that you consider that with a shoe, so it not be too flexible, and then you feel like you're running barefoot on a rocky platform. So it's not very comfortable, especially over longer distances. And that's a good way to gauge that is through holding the shoe and again trying to squeeze that. And so the Cascadia has quite a stiff sole plate, and that's something that you would segue into quite a responsive ride. The upper of the shoe may or may not have water resistant functionality. A lot of times, and I'll see if I can get the camera to show here, the inside liner here, there's some webbing that will come across the tongue. I don't know if you can see that. Yeah, so that's something that will protect the forefoot against water and try to keep that nice and dry. And you'll see that webbing come further up the tongue of the shoe in certain other models of shoes. Like Columbia is really good. The out dry is a great material for being water resistant. So there's lots of different features of shoes from the trail, just like there are shoes on the road. So it come into in your running stores. Certainly, if you're on the North Shore, try the Run Center or the North End Kintec, and they've got a good selection of trail running shoes. And they'll want to be asking you about what sort of trail running you do, what are you used to doing, what sort of distances are you wanting to do, and you may even find having two different types of trail running shoes, one for shorter, more intense interval type work, as well as a longer distance, higher mileage shoes. I know many trail runners are also doing ultras as we get into the spring. Okay, anyway, it's Michael Ryan with the Ask an Expert series here with Kintec. As if any of you are new to Facebook Live, feel free to just type in a question and I'll get that on my end, and it's a great way to have a discussion and be able to answer any questions real time here while we have me. I've got another question here from a 22-year-old female who finds every morning when she wakes up, as soon as she puts weight on her feet, there's an awful pain all on the bottom of the foot, and she finds it difficult to walk. As the day warms up, as her feet warms up through the day, it becomes easier, but the feet are in quite a bit of pain through most of the day. And so this is a patient that we would see quite commonly in most of our clinics, with either specific foot pain or sort of a non-specific general pain along the entire bottom of the foot. Now, most of the time when a patient would present this way to a doctor's office, they would say, well, you have plantar fasciitis, go get an arch support, or maybe consider a steroid injection, and then off you go. It is worth digging into that a little bit deeper, though, because it's worth discriminating whether indeed it is an injury to the plantar fascia, which is get the foot around the right way here, a band of soft tissue that's right underneath the skin, so it's on the very superficial part of the foot, and it does stretch from the heel here all the way to the toes. So it actually crosses the forefoot and attaches onto the segments of bones here just past the forefoot. And its job is to make sure that the arch doesn't drop too much, as well as it helps to reorient the foot as you are toeing off into a more efficient lever. And so it's often damaged, and people will often complain when they present with plantar fasciitis, pain right here. And so if you're palpating in that area and you're pushing in that area, it will often be very painful. If someone comes in and they've got pain along, oh doc, it feels like it's painful right on the whole bottom of my foot. It could also be plantar fasciitis, but it could also be just an overuse of the plantar intrinsics, which is a fancy word for the 3 layers of muscles that are between the bones in the bottom of the foot and that plantar fascia. And of course, if you are standing for long periods of time in the day, then your arch is going to stretch, and those muscles that are holding the arch together are also going to be under stretch, under tension, and they'll try to make sure that the arch doesn't fall too far. And they can handle cyclical movements usually really easily. So things like walking and running, these are what those muscles are designed for, and they're quite happy doing that. But if you stand for a long period of time in the day and there's just a constant static load on that, and they're under stretch for prolonged periods, the muscles get quite unhappy, and they will let you know to sit down by being painful. Of course, not all the time we're able to sit down because of work or any number of circumstances, so it's something that we use a lot of times in our clinic to come at this problem in 2 different ways. So firstly, it's good to consider stress reduction therapies or techniques. Orthotics are certainly our mainstay in the pedorthic industry for helping with that. They will help to make sure that act as a second passive structure to make sure that the arch doesn't drop too much. And when done nicely, especially through a 3D customizing process, you can achieve a high level of support for the foot and still be very comfortable. And this is something that people will feel often right away when they put the orthotics in. These muscles will relax, and the patient should feel some noticeable relief within usually seconds to minutes. The other component to this is, to stress reduction, is also in shoes. So I had mentioned before about the forefoot rocker part of the shoe. That's also an important feature here. So we don't want to let the foot stretch too much by winding up that soft tissue, which happens when you are extending the foot over the toes. So wearing a shoe that has a nice forefoot rocker will keep that foot in a more neutral position for longer if you are needing to stand for long periods and just be on your feet. So those are good techniques to reduce stress on the foot, and they are often very effective. However, it's challenging sometimes to get complete pain relief without coming at it from the other side, which is rehabilitating that tissue. And the best way to do that is through some active stretching and certain deep massage techniques. We're going to be sharing with you our show notes at the end of this that I encourage you to look at. There are a series of videos there for an exercise program that I put. I worked with Scott Fraser, a physiotherapist at the Alan McGavin Sports Medicine Center at UBC, and Scott and I did 2 studies actually looking at this exercise program that he put together. He's quite a clever guy and is certainly one of the top physios in the Lower Mainland for foot pain. For people that stood for prolonged periods of time with foot pain. And it can seem counterintuitive to have these individuals that stand, ask them to do further exercises, but a great many of people in these studies got better, and they also didn't need any steroid injections. In fact, they got better, superior results compared to steroid injection and stretching alone. And we found that when they did that in shoes that were more flexible during the exercises, they weren't wearing those shoes all the day, but certainly during those exercises they were able to get a much faster recovery in only 6 weeks versus 6 months compared to doing the exercises in your standard shoes. So those dynamic stretches and deep massage techniques are world class as far as, and something that we have started to really show to a lot of our patients now at Kintec. I'm a firm believer in both rehabilitating the tissue and managing that stress as best you can. So take a look at those exercises. We're also put 2 of the papers. We had both of these published in the Clinical Journal of Sport Medicine and Physician in Sport Medicine, which are good to share with everybody. Great. So anyone, feel free to post any questions while we're going through here. Hope I'm answering everyone's questions with enough detail, not trying to go into too much detail, because I am wanting to try to get through as many of these questions as I can in our hour slot here. I'm remiss as well. This sandal is clutch for people with foot pain as an indoor tool. If you're like me and do most of my prolonged standing when I am in the kitchen or cooking or doing errands around the house, and if you're in the house and you think that you shouldn't be wearing shoes, then have a dedicated pair of indoor sandals, and then this will, especially a sandal like this one from Sole that has an arch built into it. It's really comfortable and something that can use if you're like me that likes a nice cool foot. Then try the flip-flop option. Now it's getting a bit colder out, and while I've got on my Christmas list a house coat, because it's certainly getting chillier on the North Shore these days. Probably to go with that would be a nice pair of slippers, especially ones made by Birkenstock that have a good arch support built into it, so you can have your warmth and support too. We often overlook the support that our feet need when we are indoors. I know I do. When my feet start to ache, I will put on my flip-flops or slippers and it will feel much, much better. Couldn't leave foot pain without talking about that. Moving topics here now to children's feet. And so here on the Ask an Expert segment with Kintec Foot Labs, I'm Dr. Michael Ryan, one of the pedorthists here at Kintec. Does footwear help or hinder children's foot health? Leaving me with a broad topic here with foot health. It's and children and kids' shoes, and this is a big area, and one that I think should or could be bigger. In that I know a few years ago some of the major footwear companies spent quite a lot of money researching kids' shoes, and the industry has changed quite a bit over the last 10 years in how they consider what is optimal for children's support. In the olden days and in certain parts, especially in the European model, the idea is that because children's feet are more mobile as just a developmental fact, that the shoes they wear should be stiffer and more supportive to counterbalance that. I'm guessing to try to make them behave more like adult feet. The outcomes from some of the research that I've been privy to from some of the footwear companies suggest that maybe we should instead be trying to augment the mobility of these children's feet and let them move the way that they're wanting to move and keep them functional, as well as not put too much stuff between the foot and the ground, so as to allow them to be responsive and let the foot strengthen in a normal way. So it really depends on the case. Usually we consider foot health on a case-by-case basis. It is, if you have questions about whether your child's foot is, quote, normal or not, don't be too alarmed if they are flatter than your own feet. It's something that you can certainly bring them in, have a podorthist look at them, and they can give suggestions on whether or not they might benefit from something over the counter or custom or orthotic to help provide some added stability for the foot, as well as what footwear options are available. In many cases now, the children's shoes are scaled versions of adult shoes. We really haven't seen, we did see for a period of time, Nike had a nice line of shoes that were kids specific, using a type of sensor-based, or they called it like a foot sensor-based sole, but it was really just a thin, a much thinner midsole and an outsole that wrapped around the foot, so it provided a lot of mobility, and it was analogous to the Free, but something that was similar for kids, and they fit great. I know I used them for our eldest daughter for a period of a couple of years, and they were really comfortable, and something that I thought that she was, found functioned really, really well. I think the big thing with kids' shoes is, consider whether your child's shoes are within normal limits as far as the developmental characteristics. If they are, just make sure the shoe isn't interfering with their function. Often, if we do need to augment with any arch support, we'll usually lean on the more conservative side nowadays, with something over the counter. Also, being pragmatic, your children's shoes are likely going to outgrow any custom orthotic. In cases where there is a need for more greater stability, of course, there are custom orthotics available for this, and so these might be something we'd often use. A slightly different material, so we'd use a material instead of the standard polypropylene, which is a common plastic material, because it's very durable and has a nice semi-rigid characteristic to it in adult feet. We often use a material called subortholin, which also can become semi-rigid, but is really nicely moldable and holds really deep heel cup shapes well, and responds really well to heat molding. So if we fit one of these, our ability to adjust this to any areas of concern or blistering, we can lots of versatility as far as how we adjust these for a custom shoe. We can also add additional components to the back here. So if we did want to necessarily add a feature like this hindfoot post, which just provides a bit of additional stiffness to the back part of the shoe, then that's a great feature. So there's custom orthotics are really modular, so there's lots of things that we can add and take away from them as we need to achieve the desired stiffness to them. So so that's just a factor when you're looking at kids' shoes, but usually those are good to be considered on a case-by-case basis. Okay, now changing a little bit of direction here. Again, appreciate anyone have any questions. Feel free to put them in live. Happy to carry on conversations real time with people. Let's take full advantage of the Facebook Live functionality here, which is which is really cool. Another question here with respect to diabetes, which is great, and really an important area of work that podorthists do. Quite a bit different from the running world, but looking after the foot health for persons with diabetes. Many cases this is type 2 diabetes, and the question is how often should I be checking my feet, and why is checking my feet important in diabetes? And so really this question could depend on your current foot health and how severe your diabetes is. If your blood sugars are stable and they're well monitored, and you have no history of any complications of diabetes, then it's still good to have your feet checked. It's good to be taught how to inspect them yourself to some extent, because you're probably the best early warning detection system for anything going wrong. Probably every 6 months to a year or so, just having someone else, a healthcare professional, a podorthist, a wound care nurse, podiatrist, or your family doctor, have a look at your feet. If what they would likely look for are areas of callousing underneath the foot, where there may be callousing as it builds up underneath certain parts of the foot in certain areas, that of course is building up material away from the foot, that when our foot is then applied on the ground, that pushes and increases that ground reaction force on that part of the foot. So is something that we would feel otherwise is uncomfortable, which is why we often get calluses maintained. But if you are someone that is beginning to experience some nerve loss with diabetes, then you may not be aware that that callus is building up and that it's uncomfortable because you're losing sensation to your foot. And then the need and the risk for complications with your feet will increase significantly. So if your blood sugars are not under control, or you're not sure, or you have a history of any ulcers, then it is good to have your feet checked probably every 4 weeks, every month. And it's good to do that by a podiatrist, or usually a podiatrist or wound care specialist will be quarterbacking your care in that respect, and then having a podorthist then manage the orthotics. So we would often use a slightly different type of orthotic for this case, using soft components that are antibacterial, that are meant to distribute pressure very evenly across the bottom of the foot. So we're wanting, the key here is avoiding any pressure hot spots, number one, and then making any additions or alterations to this to help manage that. So so that's and there's a few different variations of this design, and we can get more severe if we need to, as far as offloading, and more aggressive using wound care sandals and a combination of different insole stiffnesses as well if needed. So certainly that's a great tool. We may also be modifying certain aspects of shoes as well. So here I've got a cadaver shoe, where it looks like a mild-mannered shoe on the inside, and we've opened it up. I've prosected certain areas of it here. So as I pull that back, what you might actually find is we may excavate, so we may just drill out a sequence for a portion of the midsole or insole of the shoe, so to create to create an area of offloading. So this is a very soft, spongy foam that we've added underneath here, and this would complement any sort of pressure reduction strategies that we would use in the orthotics. So footwear is really important as well to avoid any seams. So in this particular shoe, there's this great bloody big seam here. That seam in someone who is at high risk for an ulcer is a big concern, because if the foot is nicking that and they don't have an associated nervous system to tell them that's uncomfortable, that could cause a small cut that becomes infected, and someone may lose their foot as a result of that. So, so be considerate of diabetic specific shoes in this population. There are quite a few makes and models out there that will accommodate that. Consider the socks are also really important. So socks without seams and without any areas of significant pressure for your patients with diabetes. So right. So thank you for that. Any other questions on diabetes? And certainly feel free to. We could probably do a whole segment on diabetes management on its own. It's a big part and a great way to make sure that you can make a really positive impact on people's lives with good foot health management. Another question here with respect to the difference between orthotics and shoe inserts. So, what are the difference between them? In terms of semantics, they can mean the same thing. And a foot orthosis, as it's called, orthotic, of course, is the science of discipline of studying orthoses, which are the appliances that are used to help support and stabilize portions of the body. There are orthoses for the knee, back, anywhere you can think of, even for the skull. For a foot orthosis, though, typically is something that is manufactured using the patient's own anatomy, so taking a three-dimensional impression of that anatomy and then making a device that would look like this. So that's a shell that's been made to match that anatomy and possibly augment it in certain ways to then provide appropriate support or realignment of a foot as needed, depending on the professional. A shoe insert, by comparison, is something that is often purchased over the counter or thought to be purchased over the counter. It may or may not have an arch support to it. Its job may be to simply provide extra cushion, or it may be to help provide a lower sort of dose of the support that a custom foot orthotic would do. So they can be, the over-the-counter lines are a good first step, especially if somebody's wanting to self-treat and self-manage a condition, to explore that. Some brands are better than others, and it depends a bit on what you're trying to manage. Using a Spenco gel-based shock-absorbing liner is great if you think that you are having any pressure hotspots. So if you are standing for long periods of time and you find walking on one of those shock-resistant mats is really helpful for you, and you might notice that you have significant pain, so right under the forefoot area and right under the heel, and you have a higher arch, then you might benefit from having one of those inserts that's made of a gel material to give you some pressure offloading. Likely you would find a combination of some sort of arch support, because of course having contact through the middle part of your foot is going to distribute that pressure much more effectively than something that's flat. And again, the name of the game in that is pressure redistribution. A custom orthotic, on the other hand, would be able to do that even better, because of course it's matched entirely to your own anatomy. So the precision and the fidelity at which we can make the shape of this shell match your own foot is so much higher. And this is particularly so the higher the arch that you have. So a few comments on the difference between custom and over-the-counter insoles. Both have purposes in the management of foot and lower extremity injuries. Certainly, feel free to certainly talk to your healthcare professional regarding when to use either of them. Feel free to stop by a Kintec store or at the Run Center, and we're happy to answer any questions that you might have. I'm going to call it there as far as our section now on Ask an Expert. I will encourage all of you. Thank you for your questions. This has been a lot of fun, and there is the show blog where we'll put some of those papers, our videos, as well as any other reference material that you might have. So thanks again, everyone, and we'll see you next time.